let's assess your balance.
God, it's not good.
So if you want to stand
Have you
on
been
there,
drinking already, Susie?
put your feet a
I've been very good.
little bit wider apart and put your hands on your hips. And we use this position to make sure that every time we test, it's in exactly the same position. So what we would do is just ask you to stand as still as you can from the first to the second beep. And what we're just doing is assessing the different parameters of balance. So we have three main systems of balance. We have our vestibular system, we have vision, and we have proprioception, the information that you get back from your muscles, joints, and your body. Particularly for proprioception, the neck and the feet, ankles are involved with giving that information. So first one, hard surface, eyes open, is using all three balance systems. We would then go on to do the next one. So this time, same position, I'm going to ask you to close your eyes. So in this test, we would just be looking at proprioception and vestibular because we've taken vision out, so we're no longer assessing the impact of vision on balance. And it's a little bit like peeling an onion. We go through each layer until we're just working the vestibular system to see what effect on balance that has.
No, I can't see anything on your screen at the moment. Is it? We'll get something telling us what happened as a result of this. Oh,
So
no, bottom now we've got those little
you will
squares
see.
here,
So
yes.
this was the first centre of
Yep.
centre of pressure sway
Understood.
path, and this is the second. If
Yep.
I can just ask you to step back off, and then we can fuse proprioception by putting a compliant surface on, so a nice wobbly surface, and get you to stand in roughly the same position again.
On one leg with your eyes closed. Yeah.
Hands on your hips and eyes open for the first one. So again, what we're seeing on here is this is the sway path that Susie is doing. So everybody will sway a little bit, but what we want to know is how much sway there is.
Yeah.
Now, this is a computerized program. You can do exactly the same without the force plate, and you're just clinically watching somebody to see which ones they have problems with. So here we're assessing your vision and vestibular function because we've, as much as we can take one out in a clinical setting.
So Susie's
we've
wobbling around a
reduced-
lot more on this soft surface.
She is. And then
I don't have a good sense of balance.
and then if you'd like to stand in the same position and close your eyes. So this is mostly assessing, as much as we can clinically, the vestibular system. And we'll just make sure she doesn't actually fall over on camera.
We like a bit of slapstick.
Yeah.
Lovely, and you can step back off and there. So you can see from that one, if we look at sort of the different paths, her centre of sway path was 21 centimetres when she was using all three balance systems, 23 eyes closed on a hard surface. But then as we came into looking at sort of just reducing proprioception and working on sort of vision and vestibular, bit more wobbly, and then we looked at just vestibular on its own,
Right.
then much higher. And there are tables that we can use that data against to say whether that fits the population norm or whether it's way outside that. If you're doing it without a force plate and you're just looking at somebody, if we were looking at you were obviously a little bit wobbly on that fourth test when you had there. So we go, again, is there something going on here? And again, we don't treat tests in isolation. We put together the whole picture.
Well, interesting. A slightly lower level of sophistication than this would be that we use a force plate in our clinic, as many do, for gait analysis.
Yes.
But it has a static assessment function where you can see the different the pattern of people swaying. And I imagine we could get a foamy thing and stick it on top and get similar results there.
Yeah.
We wouldn't be able to assess them quite as accurately as your machine here, but it would be useful.
Depending on what gait assessment mat you have, then yes, you can absolutely do the same test on it on the static testing. Because I have a gait analysis mat on in clinic as well, and it does depend. If this is out in the community, then I will use the same test.
Well, we use the OHI one here.
Right.
But, I imagine they've all got similar
So
capabilities.
they all have similar capacity. If you can do a static stand and measure centre of sway, then you can do this test on it.
Yeah.